are the voice of the Valley, WJER. Laurel Quillen with you, sitting in for Kelly Kyle. And joining us are some friends from Cleveland Clinic Union Hospital with your medical minutes. We welcome in Dr. Thomas Rogers, and we thank you for your service with Veterans Day coming up. We thank you for that. And you have a guest with you as well. Who did you bring today?
Thank you for having us today, Laurel. So
Always.
Today it's really, I think, some kind of that quote cool stuff that we get to talk about as an emergency department. But we have Dr. John Current here today, who grew up in Carroll County and has really been with Union since 1996, off and on, and has now been here as the department chair for us for the last 2 years. But really does an amazing job and runs a great group of docs that work there and really pairs up with our nursing partners. But Dr. Current is here today to talk about hunting season and also outdoor injuries and things that can happen as we're outside in the weather, whether it gets cold, as well as those associated with hunting. So pretty cool stuff, but interesting things that we got to talk about. So we're excited to have Dr. Current.
Well, welcome to WJER.
Well, thank you guys for having me.
Yeah, thanks for being here.
Fall is a wonderful time and to be outdoors, and also a busy time in the emergency room. So it's great to talk about this stuff.
So now, what types of issues are you seeing this season at the emergency department? What's going on out there that's getting people into trouble?
Well, one of the things we'll start to see as this weather starts to get colder are some of these cold-related injuries, and it's really not just the being out and freezing in the cold, but you have to think about our elderly folks. When the weather starts to drop, their homes are often colder. So
that's true.
Yeah. So when they're, they don't have to be in a 30-degree weather out in the snow. They can be in a home that's 60 degrees and they don't have the heat turned up. And when they're elderly, they can't compensate for the cold. Their bodies don't make the heat.
Right.
Sometimes we have them on medications that help to treat other things that prevent them from compensating for the heat. So they can become hypothermic and cold just in a home that's not even freezing.
I see.
So it's something we have to watch. The other thing every year that we see is some of our elderly, especially with dementia, that will wander out of the house and not be dressed, don't have warm clothes on,
right,
don't have their
without their
coats
mittens
on.
and scarf.
We will find them hypothermic in the snow, and they
goodness.
bring them in by squad. So care for our elderly is very important this time of year with this colder weather coming. And every single year we see this, and Grandpa in his pajamas, and they found him in the snow, and we have to try to resuscitate him. They bring them by ambulance, so it can be very serious.
And I'm sure the cold can hurt all ages. I know I nag my kids about dressing properly at the bus stop when it's freezing or below freezing temperatures as well. So I'm sure cold injuries are not just limited to the elderly, but that's good to keep in mind.
Kind of a fun fact about it. So when you think of being cold, hypothermia is a temperature drop below 95 degrees Celsius or Fahrenheit. And when you have that happen, larger people, how you lose cold is through your skin and through breathing. And if you have a large volume, a big body, you make a lot of heat and you have less skin to lose it from ratio-wise.
I see.
So larger people tend to be hotter. You notice that larger people will not wear as many warm clothes because it's harder for them to get rid of the heat because they're making heat with their volume.
I see.
Babies have a much smaller volume to produce heat, and they have a much larger ratio of surface area. So babies are much more at risk for getting hypothermia than you will see in adults because of that heat loss. The other thing is there's a couple different stages of heat loss. When you have mild heat loss, and this is, you don't need the specifics, but things to kind of watch out for. So when they're in the mild phase, that's really between the temperatures of 90 to 95. And you'll start to see shivering. And you'll start to see some hyperventilating, their heart rates go faster. And that can be a warning sign, hey, we need to start warming these people up. What gets more concerning when you get into the moderate temperature of heat loss with hypothermia, and that's 82 to 90 degrees. And those people, you'll start to get confusion, delirium, and they won't recognize that they're in that situation. And they also get something called paradoxical undressing, where they'll actually, they're cold, but because of the temperature, their core temperature and their mentation, they'll actually start taking their clothes off in the cold.
I see, start to feel
And,
hot.
and it's
so
called
they're-
paradoxical
I
undressing.
see.
So they actually
Wow.
take their clothes off, and which obviously makes
That's
things
not
much
gonna help.
worse.
Yeah.
No, and then when you get into the severe temperatures, that's when they're 75 to 82 degrees, and those are the unconscious patients. And
Oh.
once you get to that stage, then obviously you've got a much bigger problem.
Wow. So
And then in that moderate phase, the other thing you notice is they stop shivering. So if you have someone who's cold and starting to get confused and you notice they're not shivering, you're actually in a much more dangerous area.
that's a time to worry.
Yeah.
All right. So besides hypothermia, are there other cold injuries that we should be looking out for?
Yes, and what you brought up with the gloves and the hats is,
okay.
frostbite, frost nip and
right.
frostbite. And so, this is prolonged exposure to the cold.
Okay.
And as you do that, you start to get vasoconstriction in your extremities, and then you start to form ice crystals under the skin, and that can lead to tissue damage, and you can actually lose your tips of your fingers.
Oh,
It can
boy.
cause gangrene in the fingers. So it's important to keep the extremities covered, keep them warm. Bicyclers in the cold weather can get actually injuries from the wind chill factor out there. The other thing to think about with cold injuries is kind of the hypothermia and the frost nip and frostbite is how you lose the heat. You lose it through your skin, you lose it through respiration, but you also lose it through what they call conduction. So anybody that is cold in water will conduct heat away from your body about 30 times faster than air does.
Really?
So cold water immersion is a much more dangerous. That's why when people fall in a lake, fall in a pond, they're much more likely to die of hypothermia because they lose core temperature so much faster. So I love mountain climbing, being out west in the mountains. One of the big things you want to be very careful when you're out in the wilderness is not to get wet, because if you're wet and cold, you're much more likely to become hypothermic. Double whammy. So
Yeah.
stay dry, wear proper clothing, make sure our kids are dressed properly, ears, fingers, toes are all covered. And then again, with kids, you want to make sure they're not getting their toes too cold in those boots. So,
And with hunting season, I imagine that would be the case as well. If it's cold out and people are hunting, what kind of other injuries do you see from hunters out there?
so hunting's curious because, you certainly can see cold injuries being out there, but these are usually grown-ups and they're usually dressed for the occasion.
Usually.
Usually, yeah.
We hope so.
And a lot of people think of hunting injuries as, people going out and drinking, shooting each other.
Oh dear.
And that's actually not as common.
Really?
The number one type of injury that we see with hunting injuries is tree stand falls.
Is that
and
right?
yeah, so you're up in the air, you're up a fair distance, it's in the middle of the night, it's cold, you're tired. People fall asleep and fall out of their tree stands.
I could see
People
that happening.
miss a step, fall out of their tree stands. If you are over a lifetime hunter, you have about a 1 in 20 chance of having a tree stand injury from a fall from a tree stand. So,
Wow.
and there was a study in Midwest Ohio. They looked at a couple of level 1 trauma centers, and they looked at kind of what types of injuries they saw, and that's where some of this data comes from.
Okay.
And again, about 50% of the hunting injuries that they saw were from falls from out of the tree stands. And about 29% were just from gunshot wounds. So hunter safety is very important.
Right.
And from an ER standpoint, I always recommend you take a hunter safety course. Hunters, make sure your kids are educated. My sons took a hunter safety course both when they were 10 years old, before they ever carried a gun in the woods. And so make sure hunting is a big part of our culture here in Northeast Ohio, but we need to be respectful of it, and we need to be mindful of how we go about it. And treating it safely and taking care of that at a young age is very important. So if you're going to hunt with your children, give them hunter safety courses, as well as adults that do this. So alcohol is only actually involved in about 2.3% of hunting accidents.
Okay.
So not nearly as high an incidence as people would generally think.
Good.
Drugs are in about 4.6%, and of the gunshot wounds that you do see, about 58% of those are self-inflicted. So it's not people shooting each other, it's people shooting themselves.
Accidents.
They accidentally shoot themselves in the leg or the foot or the arm. And about 42% of those gunshot wounds are other people actually hitting someone.
Now, with so many people out in the woods and hunting, I've heard you guys talking recently in the past few years about the increase of Lyme disease Is that a concern still this time of year? Is that just a summertime thing? What?
No, it's a big concern in the fall. In the fall, the ticks are more prevalent, and we have had a progressive decrease in increase in our temperatures around here in Northeast Ohio. We don't have as cold of winters, and the tick population has been
79
increasing
degrees
dramatically.
right now.
Oh, yes. And so from personal anecdote, for years you'd be out and wouldn't notice. And the last 5 years, I think you'll come in, you may have 10 ticks crawling on you when you come back from hunting in the woods.
Yeah.
And so yes, but very much more ticks being seen, and we're seeing a lot higher incidence of Lyme's disease. And so when you have a tick bite, and the CDC recommendations are, if the tick's been on for 36 hours, if the tick looks engorged, then they recommend that you go ahead and get prophylaxis for that, antibiotics. And it's a one-time antibiotic treatment. So don't ignore it. I've seen just lately, I had a couple of patients, young children, come in that had swollen joints, and it was from Lyme's disease. And they didn't even, the tick bite had been a couple months ago. They didn't really pay any attention to it. They just pulled the tick bite off, and they can get arthritises, they can get swollen joints, you can get, all kind of complications from Lyme. So yeah, being out in the woods, being around these ticks can, if you get a bite, if it's been on for more than 36 hours, if it looks engorged, you should consider getting Lyme prophylaxis.
All right.
So,
any other things that hunters and people who are enjoying themselves outdoors this time of year should be on the lookout for? One
of the other things that, again, you don't see it a ton in hunting, but you can because you're dealing with wild animals. But just something to keep in mind is animal bites.
Right.
We do see rabies in the Northeast Ohio. There's actually just started, or a month ago or so, they started a program where they're trying to actually drop vaccines out to try to vaccinate animals to get rid of the rabies.
Yes.
So raccoons are one of our biggest vectors, and so are bats. So anybody that would receive a bite from rabies from a wild animal like that, they need to get reevaluated and get checked. Rabies, if you don't treat it and you actually get rabies, is almost 100% fatal. So you want to get the prophylaxis and get the shots if you get in that scenario.
Take it seriously.
Yes, take it seriously.
Always take your health seriously. I think you want everyone to take their health seriously at Cleveland Clinic Union Hospital.
Absolutely.
So, very good advice, Dr. John Curran. Thank you so much for coming in today.
Well, you're very welcome. Thanks for having us.
Lots of great information, and Dr. Thomas Rogers, we thank you for bringing him along.
Oh, absolutely, Laurel. We're glad to bring all of our caregivers here whenever we can highlight all the things they do, and especially those that have served our local community as well as that Dr. Curran has as well. So it's awesome.
Now, if someone has questions about any of these health concerns that we've mentioned, what would be the best course of action?
I think when you go on our unionhospital.org, there should be a way to at least get a hold of us. You can also talk to your primary care provider if you have any questions. And then certainly, we're always willing to see patients out of the ED. I know it's, think, I don't want to wait, but our ED's been doing an awesome job. We do have urgent care as well down the street, but you can get in and be seen fairly quickly. But always talk to your primary care doc too. It's probably the best way if you have any questions.
All right, very good. There are your medical minutes brought to you by Cleveland Clinic Union Hospital. Gentlemen, we thank you so much for being here today on WJER.